The number is 8,000. That is how many premature infants passed through Martin County's incubator exhibits between 1896 and 1943. 8,000 babies, pulled from hospitals that would not treat them, carried into glass boxes on a Coney Island boardwalk, and displayed to paying crowds between the sword swallower and the tattooed lady. The official story says Cooney saved them. The official story says he was a hero. The official story does not ask where 8,000 premature babies came from in an era when premature babies were not counted, not recorded, and not expected to survive. I have been asking that question for 6 months. I do not have a clean answer. What I have is something worse, a pattern. Start with what we know. In 1896, a man calling himself Dr. Martin Arthur Couney opened his first infant incubator exhibit at the Berlin World Exposition. He was not a doctor. No medical licensing board in the United States or Europe has any record of him. The universities in Leipzig and Berlin, where he claimed to have trained, have no enrollment records matching his name. He was born Michael Cohn in 1869 in Prussian Poland, arrived in America as a teenager, and by 1910 was listed in the census not as a physician, but as a dealer in surgical instruments. He changed his name at least twice that historians can confirm. He fabricated his credentials so thoroughly that researchers still cannot reconstruct a verified biography. And yet, for 47 years, this man with no verified identity and no verified training was the primary person in America keeping premature infants alive. The hospitals knew he existed. The medical establishment knew he existed. The Society for the Prevention of Cruelty to Children knew he existed and tried to shut him down multiple times. None of them stopped him, and none of them replaced him. As late as 1939, a typical New York hospital had one incubator. Cooney had dozens, staffed by 5 wet nurses and 15 trained technicians who lived on the premises. His survival rate for admitted infants was 85%. The hospital's survival rate for premature infants during the same period was, in many institutions, 0, because they did not try. The medical consensus, published in respectable journals, was that premature babies were weaklings, that saving them was not cost-effective, that the resources were better spent elsewhere. I need you to sit with that for a moment. This was not a fringe view. This was the mainstream of American medicine for 4 decades. The institutions that had the technology, the staff, and the infrastructure to save these children chose, as a matter of policy, not to. So Cooney filled the gap. He set up his incubators at World's Fairs, at amusement parks, at boardwalk sideshows. He charged 25 cents admission. He never charged the parents. He dressed the recovering babies in oversized clothes to show the crowd how small they had been. His nurses would slide a diamond ring over a baby's entire wrist. This was showmanship, and there is no getting around that. It was also the only functioning neonatal care program in the country. The question nobody asks is the logistical one. Where did the babies come from? Cooney claimed the hospitals referred patients to him. Some did. Desperate parents sometimes brought infants directly, but 8,000 babies over 47 years is not a trickle. It is a sustained, institutional scale intake of the most medically fragile human beings in existence, routed through a man with no license, no verified identity, and no legal authority to practice medicine, operating in a carnival tent on a beach. In an era when hospitals kept almost no records of premature births because premature births were not considered worth documenting. In an era when infant mortality was so normalized that a family might not report a dead baby to any authority at all. In an era when the distance between a premature infant and an orphan and a ward of the state was measured not in bureaucracy, but in hours. Here is what that era looked like. Between 1854 and 1929, as an organization called the Children's Aid Society, and later the New York Foundling Hospital, loaded an estimated 200,000 to 250,000 children onto trains in eastern cities and shipped them to rural families across the Midwest. They called them the orphan trains. Children were lined up at depot stops and selected by prospective families in scenes that witnesses at the time compared to livestock auctions. A healthy, strong child went to a farm family that needed labor. A sickly child went back. The Foundling Hospital sewed numbered tags into the children's clothing for tracking purposes. As many as 25% of the children placed on these trains had living parents. The organization simply decided those parents were unfit and removed the children from their custody without legal process. No comprehensive database of the placed children was ever compiled. Most of them never found their biological families. Estimates suggest 2 million Americans alive today are descendants of orphan train children with no knowledge that their family tree passes through a depot platform where strangers selected their ancestor like picking an apple off a cart. The orphan trains ran until 1929. County's exhibits ran from 1896 to 1943. The overlap is 33 years. The same cities, the same era, the same institutional logic. Certain children are surplus, certain children are defective, certain children can be moved, displayed, redistributed, and classified by agencies that answer to no parent, no court, and no public record. I am not saying these programs were connected. I am saying they shared an infrastructure of assumption. The assumption that some children were worth saving on medical grounds. The assumption that other children were worth saving on eugenic grounds. The assumption that decisions about which children fell into which category could be made by institutions operating largely outside public accountability. Because eugenics was not a fringe movement in these decades, it was the mainstream. Starting in 1908 at the Louisiana State Fair, a competition called Better Babies appeared at state fairs across the country. Infants between 6 and 48 months were brought in by their parents, weighed, measured, scored by physicians on a rubric borrowed directly from Livestock evaluation. A 1913 magazine article described the process without apology. A physician scores a baby precisely as a livestock judge scores cattle. By 1916, more than 47,000 infants had been evaluated in contests held in the majority of American states. The Woman's Home Companion sponsored them nationally and commissioned a bronze medal for winners. One 3-year-old boy named William Charles Flynn won 14 first prizes and was publicly matched in newspaper headlines with a girl who scored equally well. The headline read, "Mate found for perfect boy, African-American children were excluded from all competitions." The standard of perfection was white by design and by explicit policy. Underneath the contests was something darker. In November 1915, a surgeon named Harry Heiselden, was called to examine a newborn at the German-American hospital in Chicago. The baby, Alan Bollinger, had been born with multiple defects. Heiselden refused to operate. He told the parents the child was better off dying. Alan Bollinger lived 5 days and 8 hours. The Chicago Commissioner of Health later testified that the condition was treatable. It did not matter. A coroner's jury of 6 physicians cleared Heiselden of any wrongdoing. Helen Keller wrote an essay supporting his decision. And in 1917, Heiselden produced and starred in a film dramatizing his philosophy. The newspaper advertisement read, "Kill defectives, save the nation." That film played in theaters across America for over a decade. Indiana had passed the first compulsory sterilization law in 1907. By 1927, the Supreme Court upheld forced sterilization in Buck v. Bell, with Justice Oliver Wendell Holmes writing that 3 generations of imbeciles are enough. Between 1907 and 1963, more than 64,000 Americans were sterilized by state order. More than 60% were women. The eugenics movement was not hiding. It was legislating. Now hold these 2 things in your mind at the same time. In one building at the World's Fair, Martin County is fighting to keep premature infants alive in glass boxes. In the building next door, physicians are scoring babies like Livestock for genetic fitness. On the fairground midway, eugenics boards explain which human types should be eliminated from the population. The same grounds, the same decade, the same institutions. And the babies County was saving were, by the explicit logic of the movement that surrounded him, exactly the kind of defectives the movement wanted gone. Too small, too weak, born wrong. The eugenicists wanted them to die. The hospitals were happy to let them die. The one man saving them had no name anyone could verify and no credentials anyone could confirm. And he was doing it at a sideshow, charging quarters to people who came to watch. I have thought for months about what that means, and I keep arriving at the same uncomfortable place. The official story presents Cooney as a lone eccentric who happened to do the right thing. A colorful chapter in medical history. But a lone eccentric does not sustain an operation for 47 years across multiple World's Fairs, multiple cities, multiple decades, without institutional support of some kind. Somebody supplied him with incubators. Somebody trained his nurses. Somebody referred families to him or directed infants to him from somewhere. The hospitals that refused to treat premature babies were not simply indifferent to where those babies went. They were institutions with interests, with relationships, with funding structures. The question of what happened to premature infants who were not in Couney's exhibits, who were born to poor families, to unmarried women, to immigrants in tenement buildings with no access to a boardwalk carnival, is a question the historical record cannot answer because nobody was counting those babies. They were born. They were premature. And then they were not in the record anymore. There is one more thing. Between 1900 and the 1920s, hundreds of postcards circulated across Europe and the United States, depicting babies being harvested from cabbage patches, fished from rivers, hatched from eggs, delivered by train. They were produced as birth announcements, known in French as faire part de naissance. They were produced by anonymous studios in multiple countries and multiple languages. Salvador Dali collected them. Andre Breton collected them. The volume was so large and so sustained that scholars still cannot account for it. Some of the postcards, when translated carefully, reference relocation, repopulation, the selling of children. They cluster in exactly the decades of the incubator exhibits, the orphan trains, the eugenics contests, and the mass sterilization programs. Maybe that is coincidence. Maybe a continent-wide genre of anonymous postcards depicting babies as agricultural products produced during the same decades that babies were being systematically classified, scored, sterilized, shipped by rail, and displayed in glass boxes is simply a curiosity with no connective tissue. Maybe, but I cannot stop looking at the clustering, and I cannot explain it away. On May 27, 1911, Dreamland Park at Coney Island burned. The fire started at the Hellgate ride during last-minute repairs before opening day. Within 20 minutes, 10 acres were gone. More than 80 animals died. A lion escaped and was shot by police as thousands watched. Inside the incubator building, smoke poured through the doorway towards 6 premature babies. The nurses ran in and wrapped each infant in blankets. The people who helped carry them to safety in the street were the sideshow performers. The people society had labeled freaks. Early newspaper reports said the incubator babies had died in the fire. The papers corrected this later. All 6 survived. The Society for the Prevention of Cruelty to Children seized on the incident to demand that premature infant care be conducted only in hospitals. The hospitals still would not do it, not for another 32 years. The people society called freaks saved the babies that the doctors refused to treat. Cooney kept operating. He ran his last major exhibit at the 1939 New York World's Fair. It was a financial disaster. Premature babies in incubators were no longer novel enough to draw a crowd. He had tried to donate his equipment to New York City in 1940. The city declined. Cornell Hospital opened the first dedicated premature infant ward in 1943, using his methods and his technology without crediting him. He died on March 1, 1950, in Coney Island, broke and largely forgotten. His wife had died 14 years before him. His daughter, Hildegard, born 6 weeks premature in 1907 at 3 pounds, had been treated in his own exhibit, survived, became a nurse, worked beside him for years. She never had children. There are no direct descendants. There are no complete records. The incubators were scrapped. What I keep coming back to is not the man. It is the system that required him to exist. A medical establishment that classified premature infants as defective and let them die. A eugenics movement that scored children like livestock and lobbied to eliminate the ones it found unfit. A national program that shipped 200,000 children across the country by rail with numbered tags sewn into their clothes. A cultural genre of anonymous postcards depicting babies as products to be harvested and delivered. And in the middle of all of it, one man with a false name and no credentials, saving 6,500 lives in a sideshow tent, funded entirely by quarters from people who paid to see the lion-faced man on their way to the roller coaster. Where did the other babies go? The ones who were not in Cooney's exhibits. The ones born premature to families who never heard of a boardwalk carnival with incubators. The ones classified as defective by men with medical licenses and eugenic convictions. The ones whose births were never recorded because premature births were not worth recording. The ones who passed through institutions that moved children across the country by rail without documentation, the ones who appear in no census, no hospital record, no birth certificate, no death certificate. The historical record cannot answer this question because nobody was keeping the historical record for these particular children. They were born in a world that had decided they were not worth counting. The only man who counted them had a name nobody could verify and credentials nobody could confirm, and he did it at a carnival between a sword swallower and a lion-faced man. And when the hospitals finally decided premature babies were worth saving, they used everything he built. They just did not say his name.